Okay, guys, today is Monday, November 9th. We are going to review exam number 2. Please follow along with the questions, and if you have any questions regarding the material on this exam, please feel free to post it up on the discussion board, and we will answer it as quickly as possible. All right, so starting with question number 1. When adequate blood and oxygen are provided in all the cells, different tissues, and organs of the body, this is called perfusion. Perfusion. Textbook definition. Diffusion is the movement of particles from an area of high concentration to low concentration so it can balance itself out. Occlusion is just basically another word for blockage, and there is no such word as hypofusion. So the answer was perfusion. Number 2, shock occurs when body parts do not receive adequate, and the best answer there is oxygenated blood. Oxygenated blood. It's a little more complicated than that, but that is the best answer. What type of shock is caused by inadequate function of the heart? And that answer is cardiogenic shock. Remember, the prefix cardio always pertains to the heart. Cardiogenic shock occurs either when somebody suffered a heart attack, and a big chunk of that muscle is not pumping strong enough, reducing cardiac output. It can also occur if the heart is beating too slow, too fast. If it's too slow, cardiac output is going to be reduced, blood pressure is going to be reduced, perfusion is going to be reduced. Too fast is no better than too slow. If the heart's beating too fast, 200, 300 times a minute, chambers do not have enough time to fill up with blood. So if not enough going in, not enough is going to go out. Cardiac output is going to be reduced, blood pressure is going to be reduced, perfusion is going to be reduced. Question number 4. Hypovolemic shock results from, and the answer is the loss of significant amount of fluid. It could be from loss of blood, which would be more specifically called hemorrhagic shock, or it could be from loss of fluids through things like vomiting, excessive diarrhea, loss of fluid from burn injuries, or excessive urination. The term for that would be called metabolic shock. That's not something we covered. The prefix hypo always refers to decreased. The prefix hyper always refers to increased. Neurogenic shock results from, and the answer is damage to the nervous system. Specifically the spinal cord. Remember we talked about how your blood vessels are always in a little bit of state of contraction. That allows for an adequate amount of peripheral vascular resistance, which is a component of blood pressure. If for some reason the spinal cord is damaged and that signal to the blood vessel is interrupted or blocked off, the blood vessels will spring open to their natural dilated position. Resistance will drop and blood pressure will drop, thereby dropping perfusion. So that is neurogenic. Septic shock develops in some victims with, and the answer is bacterial infection. Certain bacteria releases toxins that causes the blood vessels to become porous and leaky. Fluid tends to seep out and also causes a whole cascade of other type of reactions in the body, leading to the development of shock. When a person experiences shock, the person's skin is usually, and the most common word we would use would be clammy, very pale and sweaty and cold to the touch. And the reason for that is when a person is developing shock, when they're losing perfusion, the first organ to sense loss of perfusion is the brain. The brain, the body, will sacrifice every other organ system to salvage the brain. And one of the first organs that's taken away from is the integumentary system, or the skin. So blood will be shunted away from the skin, reducing the temperature, reducing the color, and a natural reaction to that response, which is a sympathetic response, is release of sweat, giving that skin that very clammy type texture. Victims of shock may experience The answer is anxiety and restlessness during the early stages of compensated shock. Anger and hostility may occur a little bit later, if at all. Usually some anger and hostility more with drug intoxication or head injury. Depression and apathy is not really a sign or a symptom of shock. Lethargy occurs in the later stages of shock or decompensated shock when the body is failing at its mechanisms to maintain perfusion. 9. Why is neither food nor drink given to a shock victim? The answer is it could cause nausea and vomiting. As shock progresses, first the integumentary system will shut down and other non-vital systems will shut down as well, including the digestive system. So the process of peristalsis, the transport of food materials through the digestive system, comes to a halt. Food and liquid just stays kind of stagnant in the digestive system, and as blood is being shunted away, the digestive system gets irritated and can cause nausea and vomiting because it's not working properly. And if a person starts losing consciousness when that happens, it can cause another complication called aspiration. I'll let you look up what that word means on your own. Look up the term aspiration. Not like aspiring to be a movie star or a rock star or anything like that. Aspiration pneumonia. That's what we're really concerned about. First aid for anaphylactic shock includes which of the following? Well, first of all, to answer that question, you have to know what anaphylactic shock is. Anaphylactic shock is shock due to an overwhelming severe allergic reaction. So severe to the point where the blood pressure is dropping, the airway is shutting down, and it's a life-threatening emergency. It's not just a little itching hives and rash and runny nose. So emergency transport to a medical facility, absolutely. Transporting the victim in a half-sitting position, that's because you got to maintain the airway and keep them breathing. Determining if the victim has an emergency epinephrine kit, which is really the definitive treatment for anaphylactic shock. So the answer would be all of the above. In arterial bleeding, blood spurts up to several feet from the wound. And that's a pretty easy question because the artery force is directly correlated with the contraction of the heart. So blood flowing through an artery is under very high pressure. So if that artery is open, blood is going to spurt out with each heart contraction. Number 12. If the dressing becomes blood-soaked, what should be done? The answer is apply another dressing on top of the old one. You do not want to remove the blood-soaked dressings because by doing that, you're ripping open clots and you're starting the whole process of bleeding all over again. Don't worry about the saturated dressings. We'll deal with that in the emergency room or the urgent care. What is the most effective method for controlling most types of bleeding? Most types of bleeding respond very well to direct pressure over the wound. 1, stop the bleeding itself. 2, reduce the flow of blood, allowing platelets to aggregate or collect in that area to produce a blood clot to help prevent any further bleeding. Pressure point technique is something that's not even taught anymore. It's old school first aid that's never been proven to work. Tourniquet is effective, but for not most types of bleeding. It's usually a rare situation where you're actually going to need a tourniquet. And running cold water over the wound is not going to do anything to stop the bleeding. So, a little anatomy again. The aorta is the largest artery in the human body. The vena cava is the largest vein that brings blood back to the heart. The pulmonary artery is a large artery that brings blood to the lungs, and none of the above is not a choice. What should be done when caring for a victim of severe internal bleeding? One of the answers is not even a choice, but is to recognize internal bleeding. But of course, monitor breathing, treat for shock. Remember the ABCs. Seek immediate medical care. And that really pretty much, if you're suspecting internal bleeding, means calling 911. So all the above. Which of the following results where the top layer of skin is removed with little or no blood loss? The simple textbook definition is an abrasion, usually a superficial scraping of the skin. Which wound usually involves ears, fingers, and hands, and question and results in a tearing of a flap of skin. A flap of skin, you're going to think of avulsion. Avulsion can be either complete, where that flap of skin is completely torn off, or it could be partial, where it's still being held on by a piece of skin. In which case, you would place that flap of skin over the wound, if you can stomach it, dress it, bandage it, and seek medical care. 18. Care for open wounds includes which of the following guidelines? Protect yourself against disease by wearing exam gloves or something that you can improvise with. Expose the wound. You can't really treat an open wound if you can't see it. And control bleeding using direct pressure. So the answer is all the above. How should animal bites, dirty wounds, and puncture wounds be cleaned? Soap and water, hydrogen peroxide, use full-strength iodine preparation. Really, they should be cleaned only by medical personnel. When dealing with any of these kind of wounds, the best thing to do is to just stop any external bleeding, apply a sterile dressing, and seek medical care. These type of wounds usually need to be cleaned with high-pressure irrigation that really should only be done in the medical setting. The following should be used to irrigate a wound if you so decide that it's appropriate. And the only wounds that really should be irrigated by first aid personnel are superficial abrasions, if anything. So isopropyl alcohol, not a good idea. Hydrogen peroxide and full-strength iodine preparations such as betadine, well, that'll actually cause more healthy tissue damage. So the answer is none of the above. If you are going to irrigate a wound, the best thing to use is just regular water. Tap water is fine, as long as it's not a deep wound like a laceration or an avulsion. A bandage holds the dressing in place. And that's a very simple answer. What are the signs and symptoms of an infected wound? And the answer is all of the above. Throbbing pain, pus discharge, fever. So usually things like warmth, redness, swelling, tenderness, are all signs, purulent discharge or pus, all signs of an infected wound. First step in controlling bleeding from an amputation is, and really the most accurate answer is applying direct pressure. You may think of applying a tourniquet, but as we mentioned before when we talked about soft tissue injuries, most amputations don't bleed that much. It's hard to believe, I know, but most amputations, if they're clean cut, the blood vessels have a way of going into spasm and self-cauterizing and reducing its own blood supply. So usually the first step is still always to apply direct pressure. And if that's not working, obviously a tourniquet is considered. The bag container with the wrapped amputated part, finger, hand, or whatever anatomical peaks you can think of, should be placed on a bed of ice. Okay, so first the amputated part should be put in an airtight, sealed, usually plastic bag, and then placed on a bed of ice. Not buried in a container of ice, because that may wind up freezing the part. Container of ice water will really not be cold enough. Hot packs, that's just an absurd answer anyway. So the answer is placed on a bed of ice, and that's right out of your textbook. Of all the choices there, the only time an impaled object can be safely removed is, and out of the only chances, when it is stuck in the cheek. Remember we said when it's stuck in the cheek, it's the only time you can really see both ends of that impaled object. Now there are a couple of other situations when it's appropriate to remove an impaled object, an object that's stuck in the body. One is if it's stuck in the back and it prohibits you from doing CPR. That's not a choice that you see right here. Or if this person is in a situation where they have to be transported immediately or rescued immediately, that means life over limb. And that's another case where it's appropriate to remove the remove the impaled part or remove the person from the part that's impaling them. Under which circumstances would you leave an embedded fishhook in place? If the victim's uncooperative, injure a nearby body part, removing it would injure an underlying structure. Really, all the above. Anybody that likes to go fishing, now you see some crazy wild fishermen, professionals will just rip out fish hooks on their own and come into an emergency room just for a band-aid. That's not really appropriate care. A fish hook should really be left in place because of the barbed end. If you try pulling it out, you're definitely going to do much more damage. It should be removed by medical personnel. What we usually do in the emergency room is we numb up the finger with Novocaine, lidocaine, give that a minute to take effect, get an x-ray to make sure we know exactly what's in that finger. And what we'll wind up doing is once that finger is numb, we'll actually push the hook further through the injury until the end pops out, and then clip off the barbed end and then remove the hook. Not as hard as, but don't try that at home, please. A blood clot under the skin is called a hematoma. It affects heme, referring to blood. Homa refers to a growth. What steps should be taken care for a closed wound? Control bleeding, internal or external. Apply an elastic bandage to reduce swelling. Elevate the injured extremity if appropriate. It would not be appropriate if elevating that extremity would cause more damage or more pain. The following are advantages of suturing wounds, and the answer is all the above. The wound will heal faster, more efficiently. It will reduce the chance of infection by bringing the closed edges together, and for cosmetic reasons, less scarring. If any of you guys go to PA school, NP school, or medical school, it's one of the cooler things you learn to do. What does first aid for gunshot wounds involve? Well, hopefully you'll never be in a situation where you have to provide first aid to a gunshot wound, but very fundamental answer here. Monitor breathing, control bleeding with direct pressure, bleeding for shock, all the above. And most importantly, the answer that's not there is stay the hell away if it's still a dangerous situation. So all the above is the answer. Using a cravat bandage for an injured eye, cravats are those triangular bandages, cover both eyes to prevent the injured eye from moving. Remember, as we said before, when you have one eye injured, dressing and covering the injured eye is definitely appropriate, but if you don't cover the other eye, every time that other eye looks around and moves, it's going to pull the injured eye along with it, furthering damage. So that's why you want to always cover up both eyes. Which bandage is most appropriate for use as a sling? And the answer is a triangular bandage, otherwise known as cravats. Which of the following are possible causes of thermal burns? Thermal burns, just basically transfer of heat from one object to another. Contact with hot objects, flammable vapor, steam. So the answer is all of the above. Which of the following could result from an electrical burn? The answer is all of the above. Cardiac arrest, heart stops, respiratory arrest, the diaphragm is paralyzed, or muscle spasms that freeze the victim to the contact point, usually with alternating current sources. So the answer is all of the above. Burns that affect only the outer layer or the epidermis of the skin are considered first degree, superficial burns. Redness, warm, pain, no real structural damage to the skin, however. Blisters, swelling, weeping of fluids, and severe pain are characteristics of second degree, partial thickness burns. They require some more advanced medical intervention. The first step in caring for a burn victim with a small first degree or small second degree burn is to run cold tap water over the area as soon as possible. Now remember, it says small burn. The person's burned over a great percentage of their body, you actually don't want to run cold water over them. Rule of thumb may be 10% or more. Then you're going to put this person in hypothermia. But if it's just a little area like the hand or the finger or the foot, cold tap water running over the extremity over the burn to draw heat away and help prevent further burning, further damage. Okay, from those rule of nines. According to the rule of nines, what percentage of an adult's body surface is involved if both legs are burned? Remember, one leg in the adult is 18%. 9% in the front, 9% in the back. So both legs, 18 plus 18 would be 36%. Under what circumstances should medical attention be sought for the burn victim? When face, hands, feet, and genitals are burned, okay, because these are all considered what's called critical burns, because these are areas that you can potentially lose a lot of function, even with minor burns, so they really should be evaluated by a medical specialist. And circumferential burns. Remember, circumferential means a burn that goes all the way around a part of the body, like all the way around the arm, all the way around the chest, because these burns have a tendency to swell and constrict and cause damage to the inner structures, such as nerve vessels, muscles, etc. So A and B is the correct answer. What is the first step in caring for dry chemical spilled on the skin? Dry chemical. That's to brush the substance and then flush with water. It is much the powdery substance can cause burning in itself, but as some powder chemicals become activated and really cause a burning mechanism if you've initially contacted with water. Things like lye, which is used in dry cleaner, is a perfect example. In cases of scalp wounds, the first aider should expect, I think I mentioned this, profuse bleeding. The scalp is full of blood vessels, so even minor cuts can bleed heavily. To the following is a sign of a skull fracture. Pain at the point of injury, possible. Clear, pink, watery fluid dripping from the nose to the ear, and that's cerebral spinal fluid, which helps nourish and protect the brain. And I think we talked about how we can try to decipher if there's any of that dripping out of a bloody nose or a bloody ear. Deformity of the skull is an obvious answer, so the answer to this question would be all of the above. To seek medical attention if the head injury victim develops which of the signs and symptoms within 48 hours of the injury? Slurred speech, seizures, seeing double. I really think that question is pretty much self-explanatory. These could all be signs of what's called a traumatic brain injury. Which of the following situations would you seek medical attention for a nosebleed? Bleeding that cannot be stopped. Maybe this person is on blood-thinning medications. Bleeding is rapid. Maybe they nicked an artery for some reason or another. Bleeding that begins to go back down the back of the throat. This is a person that can wind up aspirating and gagging on all this blood. So the answer is all the above. Type of injury results when a joint is torn or stretched. Well, what primarily makes up joints? Ligaments. And so damage to ligaments is referred to as a sprain. A ligament is sprained. During the first 48 to 72 hours after a bone, joint, or muscle injury, the victim should use RICE treatment. Rest, ice, compression, elevation. Ice treatment is good too, but not as specific. Alternate heat and ice treatment. Usually for the first 48 to 72 hours, ice or cold therapy more than heat. During that initial phase, putting hot compresses on an injury like a sprained ankle can actually increase swelling and increase inflammation. Which of the following is an advantage of taking the shoe off an injured ankle? Well, it allows for better circulation, allows for the use of RICE treatment, it allows for better checking of circulation, sensory, motor sensation. But the answer is all of the above. What is the purpose of splinting an extremity fracture? And it was all in the presentation that we presented last week. To reduce pain, to prevent damage to muscle, nerves, and blood vessels as bones rattle around, and to prevent a bone from popping through the skin and becoming an open fracture. So the answer is all of the above. Which injury requires medical attention? Snap, crackle, or pop was heard at the time of injury, and there was nobody in sight eating Rice Krispies. The injured area becomes hot, tender, swollen, or painful, which may signify that there is an infection going on. The victim is unable to walk or bear weight after an ankle or knee injury, which is a good indicator of possible broken bone fracture. And which of the following is not a principle of splinting? And the answer was splint all extremities before assessing life-threatening conditions. And I hope I made that example clear when I showed you the picture of that gymnast with the vaulting injury with the horribly mangled lower extremity. But remember, as grotesque as that injury appears, you still have to make sure they're awake, you still have to make sure they're breathing, you still have to make sure their airway is open, you still have to make sure they're not in hypoperfusion or shock. It's that lower tib-fib fracture is not what's going to kill them. What's going to kill them is any compromise to the airway, breathing, and circulation. And that's it. That is your exam number 2. I'm sure you all did fine. I'll be going over the grades a little bit later on. For next week, we will be covering medical emergencies, so please read up on the material. And I'm also going to post some information regarding another potential extra credit assignment for anybody who's interested. With that, have a great day, enjoy the weather, and I will talk to you soon.